Well, good evening and welcome everyone to the Orange County Clerk of Courts, our My Health Matters series and our mental health awareness webinar. I'm Dane Weister and I'm the communications director here at the Orange County Clerk of Courts. So we do hope that you find the information here we provide tonight during our webinar is helpful and useful to you. As a reminder, we're going to allow you to ask questions as we go along. So you'll be able to submit any questions you have through the Q&A function on your screen. And we'll have a Q&A segment and answer your questions towards the end of our webinar, at the end of our webinar, and answer those questions you've submitted. Also want to remind you that we have a survey we'd like you to fill out at the end of our presentations tonight so you can give us some feedback. This webinar is being recorded and will be posted on our social media channels of the Clerk of Courts. In fact, we're also carrying this on Facebook Live right now. And so that is where you can view it if you've got somebody that would like to join us. Now, let me introduce to you, first of all, your Orange County Clerk of Courts, Tiffany Moore Russell. Tiffany.
Thank you, Dane, and hello, everyone. Thank you so much for being with us today. Your participation here today shows that you understand the importance of mental health awareness as an essential topic to address as we navigate through these ever-changing, unprecedented times due to COVID-19. So I first want to acknowledge my staff who have worked very hard to bring this webinar to fruition. One of my office's strategic outreach goals is mental health awareness, and I knew that during a challenging time like this, we needed to bring forth available mental health resources during Mental Health Awareness Month. So even though this is our second virtual My Health Matters webinar, it will not be our last, as challenges create new opportunities for us to bring you innovative ways to communicate. I also want to acknowledge our panelists who are with us today. First, from my office, the Civil Operations Manager, Ms. Lisa Donnelly. From the Mental Health Association of Central Florida, we have the President CEO, Marnie Stallman. From the Heart of Florida United Way, Vice President of 211, Catherine Rea. And finally, from Orange County Community and Family Services Department, we have the Division Manager of Mental Health and Homelessness, Ms. Donna White. So that is our panelists for us today. Thank you all so much for giving us your evening, and thank you all for joining us. And Dane, I'll give it back to you.
Okay, thank you very much, Clerk Russell. So our first presentation is going to be a video we'd like to share with you. So take a look at this.
Hi friends, today we're going to demonstrate some stretches that you can do in the office when you have an opportunity to take that break. Maybe grab a stretching buddy and let's do some stretching. So the first one we're going to do is putting our hands like we're touching the ceiling or the sky, and take some deep breaths. And if you breathe in for 5, 3, just count to 5, hold for 5, and then let out. All the while stretching, you should feel it through your back and in your shoulders. So that's just one of our stretches. The next stretch we're going to show you is for your shoulders and your back as well, and your neck. And so what you're going to do, Slice, is grab one side of the chair. I'll help you a little bit. So stretch and grab that side of the chair. And then hold for a count of 10. And then we're going to do the other side. Stretch. There we go. Stretching buddies are super helpful because they help remind you that it's time to take a break, and they can also help you get in position. All right, good job, Slice. The next stretch we're going to show you is for lower body. This is for your thighs, your glutes, and so Slice, you're going to put one foot over the other knee. So bend this knee and put this foot. There you go, good job. Now press down on that knee just a little bit, just so you feel a gentle stretch. It should not hurt, okay? Hold for a count of 5, and then you're going to switch to the other side. Good job. We have another stretch to demonstrate, and for this one, you're going to take your hand to your elbow and just stretch. Again, you should feel a little stretching, no pain, and hold for a count of 5. And these are really easy because you can be in your cubicle area, your desk area, at your chair, and still go ahead and get that blood flowing a little bit. And then we're going to switch to the other side. There you go. Good job, Slice. And the last stretch we're going to demonstrate today is an ankle rotation. And this is just to help get your circulation after being in the seated position for the better part of the day. This is going to help get that blood flowing a little bit. So Slice, you want to extend your legs and just rotate your foot. Can you go, no, not your whole, just your foot, not your ankle. Kind of like you're making a circle with your toe. There you go. And you can go around 5 times and counterclockwise 5 times, and then switch to the other leg. There you go. Good job, Slice.
Great job, Lisa and Slice. So we thought that would be a great way to start things off with a little relaxation tips, some stretching. If you don't know who Slice is our mascot, and the children love Slice, and we like to have fun with Slice and have a little levity there as we were doing some stretches. So also moving on now, and on a more serious note, we want you to know that the Clerk of Courts, the Orange County Clerk of Courts, does have our mental health division. And at the Clerk of Courts, we maintain court records when a person has to be involuntarily committed for treatment of a mental illness. Now, this is commonly known as a Baker Act. And we also have similar process for the Marchman Act, where individuals are involuntarily committed for treatment for substance abuse. If you'd like to know more information about the Clerk of Courts Mental Health Division, you see the contact information here. You can call us, or a quicker way to get through to us via email by this email address you see here on the slide. And you can contact us. So for our next presentation, we're now going to move on to Marnie Stallman. And Marnie is president and CEO of the Mental Health Association of Central Florida. She has a presentation to share with us about what most of us have been going through, right, since last year, emotional workplace fatigue. So Marnie, take it away. Thank you. Okay, Marnie, you are muted.
Thank you for having us today and for allowing the Mental Health Association to be a participant in this and really important and insightful webinar. We'll hope to share some information and also maybe perhaps generate some questions as you've been instructed to do. So let's continue and move forward. It is not allowing me to move my screen. There we go. So as we said, our topic this evening is emotional workplace fatigue. You know, within the last 14 to 16 months, we all have been managing quite a lot on our plate. On any normal given day, we also circulate and have a lot to manage, but certainly COVID has complicated this. I'd like to share a little bit about the start of the association. The association here in Central Florida has been and is the oldest nonprofit operating now for the past 75 years. And our mission is to provide mental health assistance, advocacy, and services to the community at large. One of the things that you heard, the clerk's office has the mental health division. The Mental Health Association is involved with providing volunteers that can serve as guardian advocates for individuals that don't have family members that are involuntarily hospitalized. So that's an important thing to know as we move forward. So the COVID-19 pandemic has generated lots of effects on our lives. Many of us are facing challenges that can be stressful, that are overwhelming, and that have caused strong emotions in both adults and children. I'm the mom of a 13-year-old, and I can attest that it's been incredibly stressful for the young people in our community as they manage and navigate all of the same issues that we as adults have had to. And that has complicated our mental health and well-being. You know, the actions that have occurred of social distancing, of masking, all of the isolation and quarantine that we have had to participate in has complicated and compounded feelings of isolation and loneliness. And this can certainly increase normal stresses and anxieties that can lead to more and serious effects of depression. So we want to pay attention to those and perhaps talk about how some of you have been managing through this as we move forward. as a part of the Mental Health Association, we are referring to some of the issues regarding the global issues that have affected our mental health as the second wave of the pandemic. That we've managed and dealt with the physical issues of COVID-19, but the anxiety, the depression, perhaps panic attacks you might be experiencing, triggers from post-traumatic stress disorder, aggravations of addictions issues, all have compounded, and we have seen that create a tremendous problem for individuals that have not only been managing and dealing with mental health problems, but perhaps you have been somebody that previously has not had to deal with a mental health issue, but now are finding that that has been something that is new in your life as a result of the pandemic. And we have certainly seen this pre-existing conditions with psychiatric diagnosis certainly increase, but also new diagnosis. So we're actually now in the second year of this pandemic as it gets underway. We've had some relaxations of some of the requirements like the mask mandate that we've seen both locally at a municipal level and a state and now federal level. But these aren't opportunities to relax our safety concerns. These are opportunities to perhaps double down and understand that while Orange County has reached a fantastic rate as a part of Orange County government services at nearly 50% of a vaccination rate, we still have a long way to go. And this is contributing to some of the issues we're facing at a mental health problem. So the mental health diagnosis and the COVID-19 issues that really occurred around March 13th last year really caused an abundance of news coverage to come out that has really kept us in what I like to refer to as the fight or flight syndrome. Now, those are safety measures that are built into ourselves as human beings to help us protect ourselves when we're in stressful situations or in danger. But it's not meant to be prolonged. It's not meant to be a prolonged state. And unfortunately, because of the amount of news coverage and the consistent barrage of information that we receive over the internet through our social media and other outlets, we have been in this perpetual state. And so that it has now created what we refer to, or you may have heard of, as the new normal, which is a way to refer to this state that we don't seem to be able to get ourselves out. And in that new normal, we've created new routines and behaviors like wearing masks and social distancing, but we've also had to abandon routines and behaviors that helped us feel safe, that helped us feel calm, that helped us feel centered as a part of our mental health and well-being. And that sense of loss has contributed to that level of emotional fatigue that we're now finding ourselves in. Some statistics that I've pulled for the presentation may or may not be something that's surprising to many of you watching and listening tonight. Within the workplace, we're seeing almost 76% of employees telling us that they're experiencing fatigue and burnout, that they have been overwhelmed, that their feelings of worries regarding COVID-19 have been a factor in contributing to that. And then, as I said earlier, the bombardment of issues regarding the political climate that we find ourselves in, and the worry that we have about how to regain that sense of normalcy have all contributed to this sense of feeling just really, really fatigued. The impact of COVID-19 on our mental health, therefore, has been pretty considerable. Nearly 78% of us amongst the workforce are telling us that they feel negatively affected. That 85% of us are saying that mental health issues are causing sleep deprivation, poor physical health, reduced happiness at home, strained relationships with families or friends. And let me just take a point here, as I know we started with that wonderful video about the physicality of staying healthy. The fact that we are sleep deprived, that anxiety has disrupted our normal sleep patterns that have now been going on in an extended state for more than a year, really is a strong contributor. And if there's anything that I think I could stress more importantly tonight about how to regain a sense of health and well-being, is to pay attention to how you're sleeping and how that's contributing if it's been negatively affected on all of the other aspects. You know, within the mental health community, we very much like to say mental health and physical health are so tied together, you can't do one without the other. So it's real important to pay attention to what's going on with you physically, because those are warning signs and indicators our body's giving us that we're not managing good mental health as well. And then I'm also, two other real important stats here. 68% of the people that have been surveyed through this time say they would prefer to talk to a virtual experience over their manager talking at stress at work. That's really important, because that means that they're not feeling comfortable. And if you are in a work environment right now where you don't feel comfortable talking to a manager or supervisor about stress and anxieties you're experiencing at work, you need to find an outlet to make that happen, because that's not something that should be suppressed. So among the workers that we see that's hardest hit, and I don't have a good sense of what our comparison of viewers tonight is, but we're certainly seeing that amongst the ages of 22 to 25 and 26 to 37, they're our highest participants, where they're telling us that they've been negatively affected, and that mental illness and anxiety and depression that they seem to be grappling with is really difficult. And then the third highest group is the 38 to 54. That's the category I find myself in. And I can certainly self-disclose that I feel many times fatigued and exhausted as work as we try to manage all of the areas that we are called upon to. And it's important to find results that we can rely upon. So again, a quick view of some other statistics. One of the real important things that we find specifically among adults is that they really feel that they have an unmet need for treatment. So it's really important that we access services. And I know we're going to have some speakers later in just a few moments that are going to talk about how you can connect here in Orange County to services if you feel that you haven't been able to get your needs met. So here's some strategies if you're in the employee group or workforce to help you try to cope. One of the things that we can do is we can go to our HR departments and we can ask or request if there's an opportunity to waive or reduce the co-payments that go along with seeking psychological support. That's really important because we know everybody has been negatively affected by some of the financial issues that we're grappling with. And sometimes access to care simply is because they can't afford, or you can't afford, the co-payment for treatment. The other is that we can look to our employees and our HR departments to see if there's access to mindfulness and meditation trainings. These might be services that you can access through your employer assistance programs or within the HR departments that you might find yourself. Here's a real simple one as a way to cope. Check in regularly with coworkers and ask how they're doing. One of the things we hear very often amongst individuals who are seeking psychological and mental health support is they feel isolated and alone, like their issues are singular to just them. It's really important to know and believe that couldn't be further from the truth, and that by finding individuals and sharing your experiences, there's a very high likelihood that you will find others that are experiencing very similar experience as you and can share. As managers, if you're out there watching, really important to check in with your employees and initiate conversations that might be opportunities to offer help. You can do this by coming up with some strategies to remind them of what their benefits are as team members, how to access the employee assistance program, and encouraging people to use them. Oftentimes we hear at the Mental Health Association that you as employees didn't realize you had an employee assistance program that was available to you. I know within Orange County government particularly, they've spent a lot of time investing resources and creating a mechanism for their team members within the county to understand how important it is rely on and get assistance. And I'm sure there are similar opportunities within the employee groups that are on there working and watching tonight. So one of the things that we see in that fatigue quotient is really a reluctance to come forward. And really tonight, I want to reach out virtually and invite you to overcome that reluctance, to overcome that fear and anxiety that there might not be somebody that can understand what you're experiencing, and reach to a manager and ask for assistance, or reach to a coworker that you trust and explain and share what you might be fearful of, what you might be experiencing in your home life that may be negatively affecting, or just in general, the anxieties that we have as we return to the workplace. Are we concerned about how our employers are taking care of us from a health and safety standpoint, and expressing those out to people? Stress plays a huge role in a person's life. It can negatively affect us in any number of ways, from high blood pressure, stomach problems, even migraine headaches. And so there's definitely a higher incidence when we're experiencing these emotional stressors to affect us physically, and can lead to some very long-term and even short-term acute issues like having a heart attack. So we want to be aware and on the lookout for that as well. We can compound that also by the emotional stressors, right? Feeling overwhelmed or constantly worried that we're not able to put ourselves to sleep because those thoughts intervene and intrude in our thoughts. Often feeling tired or exhausted physically because we're not getting that sleep. We're not hydrating with water. We're becoming easily irritated or angry when we find ourselves in those situations. We've maybe perhaps lost interest in activities that you might feel or enjoy. One of the things that we talk about here at the Mental Health Association that seems to be very common amongst people who have through this pandemic, particularly those that have been diagnosed with COVID, is that they have lost their laugh because of the stress, because of the anxiety, because of the pressures. The things that normally and used to bring them joy and relief have been replaced with things that are now much more heavily weighted, and then the occurrence of some of these physical opportunities of headaches, bodily pain, and then of course the possibility that use and abuse of drug or alcohol could be coming and compounded. So again, we talked about some of these signs of stress, these insomnias, the lack of mental concentration, all really important to keep on the lookout for. And so here's some strategies that we want to remind you of. And it's real simple to remember. It's an ABC. A is awareness. Be aware of what your body is telling you, both emotionally and physically. B, try to get back to a sense of balance. And C, control what's happening in your environment so that those things can work positively for you. We have positive stresses that can focus us, that can motivate us, that can make us improve our performance. Those are all positive attributes. But we also have that distress that we've talked about just recently in this presentation that we need to be aware of, because it can create and decrease performance and lead to bigger problems. So when we're talking about the effects of stress, as I've said, sleep, diet, and exercise are essential to pay attention to. Take a walk. It doesn't mean that you're not doing something great, but just go around the block and find yourself in nature and back to the beginnings. Accept help. Focus on what you are able to provide. Set realistic goals and get connected to other people are all incredibly important. You can have the possibility, as we'll probably hear in just a few minutes, about joining a support group or seek a social support area. Set some personal health goals for yourself. And if you find that none of these things are working, that is a time to seek medical attention and to talk to a medical professional about the fact that you need support. Lastly, there's a breathing exercise that I'd like to just let everybody practice. If you want to just push back for just a moment. Exhale. Let's put our hands on our stomach, breathing through our nose like you're thinking and smelling a beautiful bouquet of flowers. push your lips together and blow out like you're blowing out candles on a birthday cake. You can do this at any time, any place. And if you're good at trying to fall asleep at night and having some problems, try this as an opportunity. You can do it like I do when I'm stuck in traffic, or if I'm waiting for something that I'm anxious for. I find it's a great way to bring me back to that ABC of balance and control. And in that course of those exercises, you may feel that you're coming back to a place of centeredness. So Dana, I think I've reached my 20 minutes. I think that was pretty quick. I know we have information we can share at the conclusion of the seminar or webinar tonight. And so I'm going to turn it back over to our next presenter.
All right. Thank you very much, Marnie. Can definitely attest to some of the information you gave there. While I was quarantined at home for 2 weeks, recovering actually from COVID myself, I remember at one point when I talked with my wife about, we need a laugh, we need a laughter like we hear, right? Sometimes laughter is the best medicine. So that is definitely something that stood out to me in your presentation. So you do have to remember to still enjoy yourself and have some laughter and joy in your life, no matter what you're going through, and during times you're stressed and anxiety, and especially if you're quarantined at home. So thank you very much for that information. If you have a question for Marnie, you can type it into the Q&A section of your screen. Just click in there, type in your question. At the end of all the presentations, we're going to verbally talk through the questions, get you some answers from our panelists. And also at the end of our webinar, we ask you to take a survey for us to give us some feedback on what you thought about our presentation. So we'll do that at the end of every presentation. Now, up next, we have Catherine Ray, who is Vice President of 211 with the Heart of Florida United Way, to share with us some of the information with the 211 system and how this can help people going through anxiety or trouble, mental health, suicide, those types of things. So Catherine, I'll let you take it from here.
Wonderful. Thank you. Can you hear me and can you see my screen?
We sure can.
Wonderful. I'm Catherine, and thank you for the introduction, and I'm honored to be here. I am with the Heart of Florida United Way 211 services. And I'd like to start out with I like a little interaction here with our participants. And Dane, I'm gonna rely on you because I can't see the comments when I'm presenting, but I was curious to know how many of our attendees are familiar with 211 services. Maybe you could write it in the comment box or raise your hand up to answer.
Yeah, if you're familiar with 211, you could actually put that into the Q&A section.
Okay.
Type that in if you are, yeah. And probably, hopefully, we have a good amount of people that are on with us that are familiar. So we're getting some responses.
So
yes, we've got at least 3 people who say yes, 4.
Good.
Yeah, so we've got some. We got 5. So.
Woohoo.
Yeah.
All right, we're on a roll. Thank you. I like a little, participation, but I'd like to, for those of you, I'll try not to bore you, that are familiar with 211 services, and hopefully give you and the rest of our attendees a little update on our services that are available. We are Heart of Florida United Way 211. And I'm going to go right into my presentation. So I like to start off, that is Heart of Florida United Way 211. We are part of a state in Florida and national 211 network. 211s cover almost 96% of the geographic United States. And we do annual polling and big counts, and we're part of the United Way 211 worldwide, as well as many other organizations. But we do all coordinate on a national level. So I wanted to let you know that. And then in Florida specifically, we have 12 211 regional 211s that work very closely together that cover all of the state of Florida. Our staff and our association, our agency is AIRS, the Alliance of Information and Referral Services. We are accredited, we are trained professionals. We have to receive accreditation every 5 years, and it's very stringent. We also, I'd like to go over here, we're also accredited by the American Association of Suicidology, and we have 2 staff on site that are ASSIST, which is specific train the trainers for suicide prevention contacts. We're also, many of our staff are AIRS certified database curators for our resource database, as well as our 211 specialists. We are also contracted by the National Suicide Prevention Lifeline for Central Florida, as well as the National Disaster Distress Helpline for texting services. We're only one of 2 contact centers in the nation for DDH texting services. So what do we do at 211? We are available 24/7, 365. We provide information referrals to available community resources. And I like to stress the word available. We maintain a 98 plus up-to-date accuracy rate on all the resources we have in our database. And that's required by our AIRS accreditation. So we have a resources manager and 2 resource specialists that assist with that. Because we don't want to send clients or customers or people needing resources to bad resources that aren't available. So that's very important that we maintain that integrity of the information. We also provide crisis support services and intervention, suicide prevention. As I said, we are one of the 2 National Disaster Distress Helpline texting centers. You can simply dial 211 from your phone. You can text your zip code to 898-211. You can email us, chat, and we also have an online database that's exactly the same one that our crisis specialists use. And once they're updated, everything's updated. I'll show you that a little bit later. We also offer 24/7 language translation services. We act as the main point, the initial, I should say, point of entry for coordinated entry services for the homeless screenings for Orange, Osceola, and Seminole counties, for people seeking homeless or shelter. Whoops, went a little too fast there. We also have available our 211 counts dashboards. And I like this picture. What we do not do is talk with soup cans anymore. We have state-of-the-art cloud-based telephony and database resources available, and we're very happy with those. Our 211 partners with 6 United Ways in Florida, and we serve a total of 14 counties, and we service over 5.5 million people. In addition, part of Florida United Way 211, we're contracted by the United Way of Greater Nashville, and we service 42 counties there in Central Tennessee, and they're wonderful partners. Of all of the contacts that we receive, and that's including calls. When I say contacts, it's very important to realize that not everybody just calls us. It's text, chat, emails, but 56 of all those contacts to us are requests for housing and specifically utility assistance, and specifically in the last year for COVID financial relief services. We also act as the entry point for veterans seeking services and refer to a variety of veteran resources available in our service areas. and in addition to our United Way Mission United programs. We also have a wonderful partnership with Devereaux Advanced Behavioral Health, and people who are contacting 211 for initial crisis services have available to them for persons ages 1 through 24. We can contact Devereaux and then arrange for a mobile crisis dispatch unit to go on site for those in need. It's a wonderful partnership. We also act as the entry point for child development services through the Help Me Grow program, among many others. And one of our more recent programs is our cybercrime program for victim support. We work closely with the Cybercrime Support Network, and unfortunately, during this last 14 months of COVID, this has been well on the rise of victims reporting needed services for financial relief due to fraud. And we also assist with connecting them with resources available and assist them in filling out the FBI reporting forms as well. Our newest partnership is a collaboration between FEMA, SAMHSA, and our Florida Department of Children and Families for the Crisis Counseling Program, and this covers all of our 14 county service areas. Been a wonderful program and a wonderful relief, especially during the COVID pandemic and people seeking crisis counseling services, or especially financial crisis that they're experiencing due to the pandemic. In addition to all this, 211s and ours in particular, we're very involved in disaster and emergency relief efforts, especially here in Central Florida. We work very closely with our Orange County Emergency Management, among others, in our service areas to provide up-to-date resources available pre, during, and after emergency and disaster relief support services, especially here for storm relief. A record 30 named storms were formed in 2020. And thank goodness, Central Florida really was spared, but our sister 211s in the state were not. So we offer support to them as well. And we actually have a mutual aid support MOU with our good friends in Michigan, 211, that in need, should we ever need their support, they're there for us. And if they need our support, we're there for them. I should also mention that we have 4 partnerships with what I call safe offsites in Orange County in particular, that they, in times of need, they will, and they have given our staff emergency shelter because they have command centers and generators and everything that we need to continue operations 24/7. As I mentioned, our resource database is crucial to the work that we do. We maintain and regularly update daily, sometimes lately, especially during COVID. Resources, programs come and go so swiftly, but we currently have about 3,200 programs, and we averaged about 1,200 contacts daily in 2020. During the height of the pandemic, we saw 4 to 5 times our normal contact volumes. And I'm very, knock on wood, I'm very grateful to say that that is gradually decreasing as the vaccines roll out, thank goodness. Basic needs, rent and utilities, food pantries, of course, and especially COVID-19 assistance, which would be early on for the testing sites and now for the vaccine sites, community clinics, mental health services. And then in the last several months, it's the employment assistance programs and our VITA tax PrEP sites as well. We do do follow-ups for those that agree to provide us that feedback. Of those last year, 80% of the crisis calls were de-escalated, and we do refer them to the appropriate resources when needed. And 94 of our callers said they were satisfied with our services. 96% of the callers said they would use us again. So that's good to know. We are social. We are on Facebook and Twitter, and I invite you to join us or follow us. We do regular updates. Two things I wanted to show the attendees here that I think hopefully you'll find useful. Number one is our 211 counts dashboards. And I'm going to pull that up and bring it over here. And I hope you can see that good. These are available right through our website, which I'll show you next. But from here, you can, these are updated daily. And these are based on all of our contacts, log contacts, and the needs in our communities. This dashboard covers Orange, Osceola, and Seminole, but you can click specifically on Orange or Osceola. You can see in the last year, you can click on custom date, 90 days, 30 days, or just put in the last week if you'd like. We can go by percentage, or you can actually go by the count of referrals. So in the last year, we gave out over 130,000 referrals. Of those, you can see housing and shelter, of course, was the largest, and rental assistance. I'd like to say here that not only locally, but nationally, 211s are the predictors of community needs. We see things in the need requests that we get from our contacts before anyone else, before the banks knew about it in 2008 with the unfortunate mortgage foreclosure crisis, but we see those long before. We are in a rental assistance crisis right now. We have been for the last year. Of those, we also pull it down. So for mental health, and we can break those down into specific categories. I also wanted to point out that, so for say housing and shelter, and I click on rental assistance, we superimpose our data to the US poverty census data and by zip code. So the higher, darker green areas are your highest incidence of those specific requests. And it usually correlates to, so this zip code here of 32808, 27.7% of those persons in that zip code live under the poverty level. 12.6 are unemployed. 23.2% do not have a high school diploma, and almost 54% live in rental housing. So you can see where that need is the greatest in that zip code. So I just wanted to show you this. Like I said, it's available for free through our website. Many, we use it all the time, and many of our funders and grant writers like this. If you, but I encourage you to go into our website and check it out. It's very telling and very informative. The next site I wanted to show you was our website. It's available through hfuw.org, get help. So this is our webpage, and it is available 24/7. Our counts dashboards is on here. You can dial, text, chat with us through the website. You can go in and search. We have pulled up COVID resources, top 20, emergency disaster. We also have health and medical and mental health categories by our most frequent requests. Also, if you're a provider out there, you can also go into our provider tools and sign up for an account, and then you can update your resources and programs as you need. And we have to verify that you are the good, benevolent service that you say you are. We do have a vetting process for that. So I encourage you to check out our website as well. Like I said, this is the same website resource database that our 211 specialists use. So I just wanted to cover a few points on the COVID-19 pandemic. On January 31st, we added a data marker to track our requests, just in case this COVID-19 virus came to Florida. Little did we know. By March 16th, we moved all 52 at that time. We're about 50 staff now. As I said, we bugged out of our contact center over one weekend and moved all of our 211 staff to remote work from the safety of their homes. And we have all been working totally 100% remote since March 16th of 2020 and maintaining 24/7, 365 services. On March 17th, we added a phone queue so people seeking COVID-19 specific information could go right into the queue. By June 17th of 2020, we added a data marker to track utility and housing needs due to COVID, because at that time, the moratorium on evictions was to be lifted. It has since been extended to this June of 2021, but we have been tracking that since June of last year. And like I said, we've received anywhere from 5 to 2 times an increase in call volumes and contact volumes. In 2020, we handled, I should say, not received, we handled over 280 total contacts in 2020 and over 330 website visits for resources needed in 2020. And we couldn't do what we do without our resource database online. Just to give you a little bit for our COVID specific contacts, 32% were for housing and shelter, 58% of those for rental assistance. We've seen a marked increase in crisis and mental health services needed, but I have to say the majority have been for financial crisis. People are in financial crisis due to COVID-19. Utility assistance, healthcare, and COVID specific, especially the testing sites and now the vaccination sites. We've been, like I said, we've been tracking COVID specific needs, and almost over 23,000 from June to March for utility assistance due to COVID, and almost 22,000 for eviction assistance. If I could, I'd like to show you just really quickly, it's only 30 seconds. We have a little promo here. I like to.
No matter what, no matter when, 211 is there. Free, anonymous, confidential help. 24 hours a day, 7 days a week. A friendly, compassionate voice who can connect you to the resources you need. When life happens, 211 is there. 211. Get connected. Get help.
My name is Catherine Ray, and I can be reached at catherineray@hfuw.org, and I'll stay on for any questions at the end of the summit. And I thank you for inviting us in, and please let us know if we can be of help.
Thank you very much, Catherine. So very good information. And what was interesting to me as you were talking about the different calls and what kind of assistance people were looking for whether it's rental assistance or utility or food or unemployment, all those topics, right, can relate to mental health or can affect somebody's mental health. So just interesting that, no matter what they're calling about, mental health is very much at the core of all these things that we go through during this time. So thank you for that information. And if you have, again, a question you'd like to ask any of our panelists, just simply type it into the Q&A section on your screen. And once we get through all the presentations, we're going to go through any questions you may have. So our next presentation, we have Donna Weish, who is the Mental Health and Homelessness Division Manager with the Orange County Community and Family Services Department. She's going to share with us what's called Orange Connects. This is a new resource that the Orange County has rolled out recently. Donna, here to share more information with us. Donna?
Thank you, Dane. Can you see my screen?
Not yet.
This is the problem I had last time.
Go ahead and
back.
try to share, or if not, we have a copy. Oh, there we go.
Have you got it up, Dane?
Yes, we have it up for you now.
I'm not sure why it's not sharing. Okay. All right. Well, sorry for my technical difficulties. I was working earlier. Thank you very much for this opportunity. As my colleagues have so eloquently shared with you, there's so many issues surrounding what's going on in our country, and certainly that drills down into our community of 1.4 million people. So we had a great opportunity through some CARES funding, federal money that came down to our county to address some of the issues on the social side of the equation. I know small businesses needed some help, but individuals needed help. So if we can go to the next screen, Dane.
Yep, we're at the next screen. Go ahead.
I'm not seeing it for some reason. There it is. There it is. Got it. Thank you. So what we saw was a lot of, I don't know what's going on here, a lot of increase in mental health and anxiety and depression symptoms. We're seeing across the country a 31% increase in anxiety and depression, a 26% increase in trauma, stress-related symptoms. Marnie went over a lot of this in her presentation, but really, as we were seeing this roll out, people using more drugs and alcohol, and even introducing new substances into their routines. And 1 in 10 adults, the CDC says, have seriously considered suicide during this time. We're seeing younger adults, we're seeing an uptick in children of color committing suicide, which has been something that we haven't seen in our lifetime, and just disproportionately worsening mental health symptoms and outcomes. We go to the next, please. So we know that we need to have diverse means to address individuals and their diverse needs. Carl Jung said that the shoe fits one person, the shoe that fits one person pinches another. There's not a recipe for living that suits all cases. And we know that. We know that we have a system of care in Orange County that doesn't necessarily meet the needs. We can't meet every need. The state of Florida funds mental health services, probably some of the lowest in the country. We have 1.4 million people, and there are some groups, advocacy groups in the state of Florida that indicate that only 30% of people who need community mental health in a public setting can get it. So all of those things you see in that continuum of care are things that we need to address in our own community that unfortunately we don't have enough resources for it. So we got to thinking, what if we took some of the CARES funding that we had and developed a navigation system? We use one currently for our children's mental health system of care, and it makes it very seamless. So we thought, why not now? Why not us and why not now? So go to the next day. So it's Orange Connects is the name of our web-based system. It's a navigation system that is designed to connect individuals with the relevant behavioral health supports that they need based on an assessment. So it's intuitive, it's simple to use, and those behavioral health services that it can help you with is anything from mental health services, peer services, counseling services, case management, substance abuse, anything that fits under that umbrella of behavioral health is what Orange Connects offers us. Next, please. So how do you connect to Orange Connects? It is so simple. It's like going on Amazon.com and ordering anything you need. It's simple. It's connected by going to www.orange connects and clicking the link, and then you can use it through an Apple or Android mobile device, your tablet, and it has every protective confidentiality service allowed. So anything that you put in that your personal information in, it remains protected and remains confidential. The only service providers that you designate will get your information and you will send it to them. But it meets every safety and security standard through federal or state law. Next, please. So it is the most simple thing, and I just want to show you some screenshots of Orange Connects. It tells you what it is the minute you open the app, and it gives you an understanding of what it is for Orange County residents. It tells you what it's going to do for you, and then it also tells you, because this is not a crisis line, this is not for crisis. This is for folks that are feeling some anxiety and some depression and out of sorts and looking for an opportunity to get some help. And we know that some people are in dire straits. And in that case, we're going to tell them to call 211, Catherine's organization at the United Way. Or if you want to speak with someone if you're in a domestic violence situation, we give the information to call the 800 line for that specific issue. Next, please, Dane. So here's where you start. And when you go in, it's going to ask you date of birth. It's going to ask you if you do have insurance, because that will determine who is going to accept the referral. And it asks what language that you use, that you prefer to use. And this has Google Translate. So any language that you choose, you will now have an opportunity to view all of the further information in that language. And next. So this is what it looks like when you get to the Google Translate. You'll have your date of birth in there. You'll tell them if you have or have not insurance. And then you just go to Google Translate and it automatically sends you to the list of all the languages. And there's a lot. Now, I want to be sure to tell you that even though this site will translate into the language of your choice, you may not be able to find a provider that also has that language, but at least that information is available to you. Next, Dave. So this is the next screen, and this is where you start your self-assessment. And it will ask you if you're filling this assessment out for yourself, because you can also use this for your minor child. No one under the age of 18 can use this site, but they can have a parent or guardian use this site and get information to someone for their child. So these are the questions. You're going to be asked about 27 questions. They're going to ask you whether or not you've been affected by each of these problems in the last 2 weeks. So they want to know what your current situation is and how you're feeling currently. So we'll go through each and every one of those questions, and you'll hit yes or no. See the first question: if you're feeling nervous, anxious, frightened, worried, on edge, or feeling panicked or avoiding situations, excuse me, that make you anxious. Dane, next. So you have the opportunity to refine your search, but all of those, that assessment that you've put in is going to navigate you to those individual providers that provide a specific service based on your specific need. And then you'll have a Google map that will tell you where they are in relation to your home or to your work. And so it is navigated by GPS. And so you can go through them. You can look at every one of them. It tells you a little bit about the organization. It tells you what they offer, the days of service that they're open. And you can choose which provider based on what the system has brought up for you, based on your criteria and your symptomology, what they will, where that agency is, and you can send your information to that specific provider. Next. Once you do that, you can click on the places that you think you might be interested in. For example, if you choose the Children's Home Society, you can rate it. If you can see how other people have rated it, you can see everything about that organization. It tells you what payments they take, tells you what languages they speak, and tells you who they work with in that organization. Next thing. So once you get to this point, you have put in all your information. You have selected a provider, perhaps, and you can submit as a guest. You can make a profile and get your login information, or you can create an account. Next, Dane, please. So here you are, and this is where kind of the rubber meets the road, if you will. Now you've decided that you want to send this information. So you fill out all of it, you make sure it's all right, and then you go to the next slide. And you have now chosen to send your information to this provider. You electronically sign it, and then you can send it. Next slide. What you will find on Orange Connects is it is a seamless navigation system. We've tried to develop something that will allow you at your own pace and in your own home to come to a situation that you want a provider to engage you. So once you have sent your information to them, that within a certain amount of time, hopefully within 24 to 48 hours, that provider will contact you, hopefully to set up an appointment or to talk to you further about what you're seeking. The Orange Connects is a platform that we believe has the ability to not only be seamless, but to grow with our community. We started with the behavioral health side of the operation right now, but we believe it has the ability to grow into primary health care or a number of other services that could help you online. What we've noticed is a lot of people are seeking help virtually. And within that realm, people want a navigation system that they don't have to make tons and tons of phone calls to get where they need to go. We have used this platform with our children's mental health system in Orange County, and it has become really some of the best work that we've done in navigating people based on an assessment to the right resource. And we're in hopes that Orange Connects will help our community. I appreciate the opportunity just to share it with you, where we've started slow in loading up a lot of the public providers and private providers, but there's more to do. And we're hoping that more providers join and give opportunities for more people to be connected to more services and more diverse services. So I really appreciate the time. I apologize for my computer issues, technical issues, but I do appreciate the clerk's office being very flexible and helping get through this. Thank you very much.
Thank you very much, Donna, and really great information that you were helping provide here. In fact, don't go away, because we actually have now gotten a couple questions in. In fact, if you have a question, please just type it into the Q&A section, and we still have a video coming up. So I'm kind of teasing that for everybody to stick with us. We have some meditation tips and techniques, but going to go to one of the questions because it's related to Orange Connects, Donna. The first question we received is, are the providers part of Orange County government, or are they private providers as well?
That's a great question. And the providers are public and private providers. Orange County government, we do not actually serve individuals in a mental health setting. We contract those services out into the community. So those will be private providers and public providers that will be providing that service.
Okay, great. And we have another question related to this. We have somebody who lives in Osceola County. Can they still use the services?
I would anticipate that just because we set this Orange Connects up for Orange County residents, I would anticipate that if you can't get that service in Osceola County, that you could certainly use Orange Connects if you want to come, because the providers that are on the system are mostly Orange County providers, but that does not mean they won't serve people outside the county.
Okay, very good. Yes, and if anyone else has a question for us, don't forget to type it in. So in the meantime, while you're thinking of any other questions you might have for any of our panelists, let's take a look at this next video. Our Civil Operations Manager, Lisa Donnelly, and Slice are back with some meditation tips and techniques. Enjoy.
Hi friends, thanks for joining me today. My name is Lisa Donnelly and I'm the Civil Division Manager here at the Orange County Clerk of Courts. I'm here today to help you learn some techniques about meditation. There's a few different ways that you can approach it, and it's not nearly as hard as you think it might be. One of the ways that you can start meditation is called meditative doodling, and it's just what it sounds. If you like to doodle, and a lot of us do, when you take notes and that sort of thing, you're in meetings or in class, oftentimes you'll see people just kind of scribbling. And so that's exactly what meditative doodling can be. It can be a little more structured than that if you'd like. I think most of us have heard of adult coloring books by now. And so these are some examples that I brought from you, some super intricate stuff, but it's really just about focusing your attention and having that moment to yourself to kind of decompress and focus your thoughts on something positive. So there's that, and it can be a little more unstructured, like some abstract work here. And then you can also use things like stencils to help you kind of doodle as well if the free form isn't really your technique. Another form of meditation is meditative walking, and it's just what it sounds like. You get yourself kind of in a comfortable position, allowing yourself the time. You can use a timer. You can also listen to spa music if you like, or just have that time, quiet time to yourself. One of the methods that you can use to kind of help focus your thoughts during meditation is using a mantra. And that is just a very positive affirmation, a word or a phrase that you say to yourself repetitively, just to kind of help keep your thoughts from wandering and stay focused right there in that moment, okay? So one of the mantras that I use is everything that I have is within me. And so I repeat that to myself. So whenever I start to think about my to-do list or all these other things that, I think I need to be focused on, I bring that back to my meditative time. And I also set my timer for about 5 to 10 minutes, depending on, what my schedule is like that day. So I'm not worried that I'm going over on my time. So you can use doodling, walking, or you can use what most people know as more traditional meditative techniques, and that's when you are in the seated position. And same thing, it's really just about setting that timer and about using an object if you'd like. I brought a couple with me today to show you. So we have a rock, and this is something that you hold in your hand that you focus your attention on. And then I also have a bracelet, some rose quartz here. So both of these can be used as an focus object for meditative walking or your traditional meditation. And then I brought a few things to help at nighttime too. So you can meditate really any time of the day. A lot of people like to start their day with meditation or even end it. So if you're one that likes to end your day with meditation, there's a few essential oils that you can use to help with a diffuser or a reed or an air diffuser that kind of puts the steam into the air. And so lavender is a really common one to use. And these are fantastic because they're not generally terribly expensive. You can find them just about anywhere. And another thing I like to use is the sleepy time tea, and it just has a relaxing property to have a nice warm drink. So we're going to show you a couple of demonstrations about the meditative walking, traditional meditation, and then I have a pose that I'd like to share with you that's really good to practice before you go to sleep at night. We're going to have Slice demonstrate a meditative walk for you. There's a couple of different ways you can do it. I'll demonstrate the first one. It's really just with your hands behind your back in a comfortable position and just kind of taking a slow stroll. And again, just keeping your thoughts focused and clear. And then Slice is going to meditate another way, and that's with an object. Go ahead, Slice. In addition to your essential oils and sleepy time tea, this is a yoga pose that you can do before bedtime. What Slice is going to help us demonstrate is the position where we're going to get as close to the wall as we can and put our legs up. And what this does is help our circulation and help reduce that heart rate, so we have that calming effect that we need before bedtime. So if you suffer from insomnia, this is a great way to combat that. This is a more traditional meditative pose that our Slice is demonstrating for us. So we're sitting with our legs crossed and our hands out. And one of the ways you can draw your attention is to hold your hands like this. And another method you can use is to pinch this area right through here. But you don't always have to sit like this. And so you can sit with your legs straight out, or really whatever position is comfortable for you. Maybe have some pillows around you, just so your back doesn't get tired. And then start your timer, your music if that's what you like, and start your meditation. Thank you for joining us and allowing me to share some of the things that I found useful, and I hope they're helpful for you.
Thank you, Slice, and our Civil Operations Manager, Lisa Donnelly. So great information, some great techniques. We always love to see Slice and use Slice, our mascot here at the Orange County Clerk of Courts. in some of our videos. We hope you found that to be useful. We have gotten in a couple of other questions, so a couple more questions. And if you have a question, anything you'd like to ask, because we're at that portion of our webinar now, our presentations are completed. So any information you've seen here, anything that may have prompted a question for you, just type it into the Q&A box, and we will try to get those answered for you. So one of our first questions was that we had somebody that was able to sign on or get onto our webinar a little late, and asking if this is being recorded. It is. So we will have this recording available after this webinar in the next couple of days. It will be available on our website, which is myorangeclerk.com, myorangeclerk.com. Also, we will post it to our social media channels. It actually is being broadcast right now live on Facebook, so you could even catch some of it there as well, but it is being recorded, and we will share it with you. One of the easiest ways is just to go right to our website. One of the other questions we have here is, how does a provider contact, or who does the provider contact to become a provider? I think this is related back to Donna and Orange Connects. Donna, you want to help answer that for us?
I will. We're excited to have providers contact us and let us know that they want to get on Orange Connects. We need more providers on Orange Connects. So I would urge you, just call 311 and have them get you in touch with the Mental Health and Homeless Division, and they will direct you to us either by phone or by email.
Okay, thank you. Great. Another question that was just typed in. So this question, the world is opening up, but I'm still afraid of going out, being in restaurants or friends, because I fear I'll catch COVID-19. How can I resolve this? Wait, it's too soon. Aren't we all at risk? So it looks like Lisa, maybe something you might be able to help answer, or anybody on our panel. Again, question being that, hey, if you're still afraid of going out, being in restaurants or friends, because you're fearful of catching COVID-19, how can somebody, I guess, resolve this within their own mind? They might feel it's still too soon. And maybe if you feel it's too soon, then really you should continue to take the precautions. Anybody else on our panel want to help answer a little bit more with that?
I can probably speak to that just a little bit. Certainly with the providers, they're utilizing technology just like we are here this evening. So depending on what type of services they're looking for, I think there's a lot of therapeutic opportunities that are available either through video or phone calls. And I think there's certain probably chats that are available as well. In terms of filing anything with the courthouse, with this particular case type, we do need that person to file that at the courthouse, but it can be mailed. So that's an opportunity as well. They could just contact us at the previous contact information that was listed on the other slide.
Gotcha. Okay, thank you, Lisa. Yeah, go ahead, Marnie.
Dean, I just wanted to comment about the question regarding still not feeling safe. It's really important as individuals that we get validated for how we feel, even if it's different from how other people around us may be responding. And it's important when you express yourself to ask to be validated, to ask the people that are around you to say, I acknowledge how you're feeling. It's different perhaps than how I feel, but I acknowledge that you get to have those feelings, that they're valuable, that they're real, and that they deserve to be heard.
Good point. Very good. Very good. Thank you. There's a second part of this question related to work. Do I have to go back to work? How do I tell my boss I want to work at home? Besides, I'm doing more work now than when I was at work. So of course, this would be a question based on individual organizations and how they handle back to work and remote work and that sort of thing. But again, go ahead, Marnie.
What I was going to let the questioner know is that psychological and psychiatric diagnoses are part of your medical condition, and as such are protected under the Americans with Disabilities Act. So it's up to you to inform your employer and for you and they to work together to accommodate what you might need so that your work environment is in mesh and concert with what your needs are. And so again, that's a little bit back of an ownership on the employee to vocalize to their HR team, to their manager, to their employer, what they need and how they can best get those accommodated.
Gotcha. Great information. Okay. At this point in time, we don't have any other questions. So I think we're getting towards the end of our webinar here tonight. Please don't run off though, because we'd really love for you to take a survey. If you have joined us as an attendee, please stick around. It's a short survey. It will give us feedback, what you think about the topics we provided tonight, our panelists, and our presentations. So I want to personally thank everybody for joining us. Thank our panelists for taking time as we provide this as a service to the community, these free webinars. The Orange County Clerk of Courts likes to bring partners together, address these types of issues and provide resources and information. The Orange County Clerk of Courts, Tiffany Moore Russell, is thrilled to bring everybody together to speak out, especially during Mental Health Awareness Month, this month, during the month of May. We hope you enjoyed all the topics discussed in the webinar, and a big thank you again to all of our partners. Now, once posted, you may view this video at any time that you'd like. Again, it is going to be on our website, on our social media channels. So thank you for joining us. And please, again, take the short survey. It will pop up on your screen at the end of our webinar here. And we'd really love to get that feedback from you and see how you enjoyed this topic, and share with us other topics you'd like to see in the future. Thank you. Have a great evening. Thank you for joining us.